would just begin by giving some sort of an introduction to many of the participants about our own university. We are almost a 35-year-old organization, which started as a medical college way back in 1985 with about 100 students. Now we have moved on to have 12 different faculties. And right now, the Department of Occupational Therapy is a part of the Faculty of Allied Health Sciences. But I'm sure in 2 years of time, it is likely to become a separate faculty by itself. We also have a Faculty of Dental Sciences, the Faculty of Nursing, Faculty of Pharmacy, Biomedical Sciences, and Public Health. And we recently have started the Faculty of Engineering, as is related to biomedical engineering, artificial intelligence, and cybersecurity, and such type of niche branches. We also have a Faculty of Sports Sciences and Faculty of Clinical Research. We are a quality organization who always care for quality 24/7, all 365 days. And this has resulted in accreditation both from national as well as international agencies. We are NAC accredited with a CGPA of 3.62 upon 4, one of the highest for any healthcare university. We also are accredited for the hospital by both the National Accreditation Board for Hospitals and also by JCI 3 times over. In 2016, actually, when Raghuram actually walked into my room, when at that time I was the Director of Academic Administration, and said, asked actually about my views about occupational therapy, I immediately put my thought process into thinking how this particular education could be taken up by Ramachandra in a very serious way. When I looked at the Google, there were hardly 4 or 5 private institutions which actually ran a program in occupational therapy. Of note was the Manipal University. Then we also had the Christian Medical College, Vellore, and the SRM College of Occupational Therapy, Chennai. So there are far and few colleges which actually ran a bachelor's program or a master's program in occupational therapy. This is not the scenario in the Western world. When I went to US as a Fulbright scholar, I had the occasion to see almost 16, 17 universities. Almost every single university was actually running an occupational therapy program. So to that extent, I felt even in the government sector, they did not have sufficient number of institutions which actually embrace this particular education. So I straight away thought that the government as well as private institutions not having taken up, this is something which will really attract students. And so I put in my thoughts, and we were able to actually begin this program in Ramachandra, the BOT, the Bachelor in Occupational Therapy, in the year 2017. And ever since that time, Raghuram has been a very active person, proactively trying to do whatever is right, getting the appropriate integration from all the specialist areas, and he has been able to put together a program which attracts almost 40 students on a yearly basis. So we are indeed happy that today you are all celebrating the World Occupational Therapy Day, and I congratulate each and every one of you for this particular celebration. Now, it was the 27th of October 2010 which this particular concept was adhered to by the World Federation of Occupational Therapists, and ever since that time, every year this particular day is celebrated. And I'm very happy that today you have brought in an expert speaker in Dr. Sendil Vadivel to address all of you, and I'm sure he's going to open up quite a lot of good discussion on the subject. This year's theme, as I understand, is reimagine doing. See, the occupational therapy is a very important branch in healthcare. A lot of people do not understand this, and they expect the physiotherapists actually to do this job. Any illness, any trauma, any even congenital problem there are always morbidities and difficulties for a patient. And it is essential that we actually go into depth in order to rehabilitate him, not only from the physical disability, but also from the mental and other social aspects that a person may be suffering from in these disorders. At Sri Ramachandra, we ourselves have a department under the name of Vidya which caters to many children in their early days of education who are differently able. Now, this organization probably started almost 14-15 years back, and now we have been able to attract nearly 80 to 100 children who constantly come to this learning center. Now, these are the days of COVID. We all know that COVID has, as a pandemic, has taken the world by surprise, and it has also taken the world to have quite a lot of morbidity and mortality, although India has, to an extent, the numbers are high, but the mortality has been relatively low. We are trying to overcome the pandemic by following some of the basic principles of social distancing, by actually hand washing, and also by wearing masks. But still, the numbers are increasing. Probably Tamil Nadu is on the verge of coming down, and we can say we have probably crossed the peak, but we are worried about reinfection and also about a second peak and things like that. So we really do not know the light at the end of the tunnel, but following COVID, we do find, and this is following my interaction I had with a lot of physicians who have treated this, the after effects of COVID also requires quite a lot of counseling and quite a lot of treatment. Now, from that point of view, it is very relevant that the Occupational Therapy Association, the Tamil Nadu Orthopedic Association branch, have actually put up the theme as Reimagine Doing. We need to think differently and see how best we can help these type of patients in the best possible way. When we look back into the history, we can see that the drastic development of occupational therapy began every time from a crisis. Whenever there is a crisis, we must understand that there is also an opportunity. So this is how I'm sure the occupational therapy department has also taken into the present crisis. The branch as such actually developed following the World War I, when the US military recognized the benefit of reconstruction aids, providing OT services to those dealing with mental health and physical dysfunction challenges after the war. So this was the first beginning of actually trying to provide appropriate tools for people to use some of the disabled parts of the body, and also to help people when they are actually low in terms of their mental health. Here at Sri Ramachandra, we do have a good collaboration for the occupational therapy department with the Department of Orthopedics, of which I am also a part, with the Department of Neurology, with the Department of Psychiatry, with the Department of Pediatrics, and almost all the branches where they can provide help, they have been able to do. We have established occupational therapy clinics in the hospital, and the faculty members of this particular department go and provide the service for many of these patients. So it is a work in progress. Our first set of students who joined in 2017, as this program is a 4-year program, which is followed by a 6 months internship, are actually going through the final stages of the training, and I'm sure all of them will come out successful in the ensuing exams, and this will sort of make them to come back as good occupational therapists. And nowadays it is probably they are the most wanted in terms of the health professionals from various hospitals, including corporate hospitals. Now, so having realized the potential for occupational therapy, there is scope for many of these kids to actually take up a postgraduate program. and we are in the process of actually starting a master's in occupational therapy, and some of them can even pursue extraordinarily good research as PhD candidates. So they have a long innings to go in Ramachandra itself. Otherwise, even as a BOT, when they're attracted towards some hospital, they can be provided appropriate jobs. I am extremely happy that today, under the leadership of Dr. Raghuram, this particular program has been organized, and REMA has brought in the initial inputs in terms of what we are doing. And I am sure with the leadership that Raghuram is showing, not only towards REHAB, but also to the Tamil Nadu branch of All India Occupational Therapists Association, this particular branch will definitely grow to greater heights in the future. So I am extremely happy to be part of this program, and I consider it a great honor to actually formally inaugurate this particular webinar on, and the present team that they have kept for this thing is Soap Notes. Now, in JCI, when we actually went in for the accreditation in 2009, the Soap Notes was something, a new thing for all of us. That is recording the patient's details in a structured format. What are the subjective symptoms? What are the objective findings? What is the basic assessment? Followed by what exactly is your plan of action? Now, in the past, the medical professionals hardly used to talk to the patients regarding the plan of action. Today, you cannot tell the patient that I will continue to treat without informing you what I am going to do. That is not acceptable. So it is essential that we have a clear plan of action, even for rehab. That's what I told, even for COVID. Many of the hospitals, after they treat the patients, they do give a definite indication of where these patients should approach for their post-COVID rehabilitation. So to that extent, I think the theme of Soap Notes, on which our expert resource person is also going to throw a lot of light in terms of what we can do. There is something called functional assessment that comes very early when the patient gets admitted to a hospital. Now, this in most of the places was carried out by the physiotherapist. But I personally feel that an interaction between the occupational therapist and the physiotherapist will go a long way in providing adequate care to all our patients. So I welcome all these healthcare professionals under the banner of occupational therapy to be part of the whole healthcare team. And I'm sure with the inputs from everyone and with an integrated approach, we will be able to provide adequate, extraordinarily good care to all our patients.